Here is your question. Right. So if you have read and understood, considering the critical care scenario, kindly please tell me how would you manage this patient now?
Okay, yes, I will manage the patient using the CRIPS protocol. So I want to check the patient's airway and ensure that the patient is breathing. Make sure that there is nothing in the mouth of the patient, and then also feel the his nostril to feel that air is coming out. I will look at the chest to ensure that he's breathing, that she's breathing, and then check the chest expansion, and then listen to the chest and also percuss the chest, and also count the respiratory rate. I also check the heart rate and the respiratory rate, the BP, and then also auscultate the heart to listen to the heart sound, and then take secure ear samples for secure intravenous line. Take blood samples for electrolytes, urea, and creatinine again. Then after securing the IV line, I want to give him IV intravenous 10% calcium gluconate slowly over 10 minutes to correct the hypocalcemia that he has. I will connect the patient to ECG and be doing a continuous ECG monitoring for the patient. Then I will check assess the neurological status of the patient using the AVU.
Considering the condition of this patient, how do you expect patient's neurological competence to be?
Yes, it's possible that the patient will be anxious, but may still be conscious. And if the level of the severe hypocalcemia, it's possible that there will be affectation of the laryngeal muscle, which could cause patient respiratory distress, and patient may not be unconscious, maybe unconscious.
In this scenario, can you please tell me what might be the cause of hypocalcemia?
Yes, it's possible that there is an iatrogenic parathyroidectomy during the thyroidectomy that was done for the patient, and there could also be an ischemic injury to the blood supply to the parotid glands, causing the.
If you will do the thyroid function test, how would you expect the results to be?
The thyroid function test.
Yes, please.
Yes, the thyroid function test in the patient can either be normal or low.
No, but which ones are you telling me? T3, T4, how would you expect them to be?
Okay,
and
yes,
TSH?
Okay, the TSH could be in the normal value, then the T3 and T4 could be low, or normal, though they didn't mention whether patients had a total thyroidectomy to say that all the thyroid hormone, or there will be no organ producing thyroid hormones after the total thyroidectomy.
All right, okay. Considering that you have checked calcium level and it appears to be 1.7 millimole per liter, can you please tell me what does that signify, or what does that tell you?
There is a severe patient has a hypocalcemia. The
yes,
calcium level.
What should be the normal range?
Yes, the normal range should be about 2 to 2.25 millimole per liter.
All right. How is this calcium found in the body?
How is the calcium?
Is present in the body? How, in which form, or how is it present?
Yes, it's present in both the ionized form, now about 1%, and then also present in the bone as part of the bone inorganic component.
Yes.
In 99%.
Yes, I want you to please tell me, like 1% is present in free form, other,
Yes,
how much
other
percent is in bound form?
yes, 99% is present in bone. Out of the 1% that is the free form, and 50% is in ionized one, then 45% is bound to
Okay,
plasma protein.
how patient's situation in this condition, hypocalcemia, would affect the ABG results of this patient? You said the patient can be anxious, so
Yes, the patient can have metabolic acidosis.
okay, right. Why do you think so? What might have happened to the calcium levels?
What might happen to the calcium level is
Yeah, calcium
the
has
calcium.
been ionized because of the acidosis. Okay, we'll move
Yes,
on. Can you please tell me how this calcium is metabolized, or why, what this calcium is used for in the body?
okay. The calcium is useful in the coagulation cascade. Then it's
Yes,
also useful in mineralization of bone,
yes,
and then also involved in muscle contraction, both the
yes.
skeletal muscle and the cardiac muscle. And then it's also a second messenger in some
Yes.
cellular functions in the body.
Okay. Since a patient is suffering from hypocalcemia, which muscle would you be worried about? The patient is, yes,
The laryngeal muscle,
yes. Why?
because of laryngospasm, is a possibility, and that could lead to airway obstruction in the patient.
Can you name the hormones which are responsible or involved in the regulation of calcium?
The parathyroid hormone, the
Okay.
vitamin D3,
Yes.
and then also calcitonin.
Yes. Can you please tell me the function of vitamin D, or the role of the vitamin D in this?
Yes, vitamin D is enhances the absorption of calcium in the gastrointestinal tract. It also enhances the calcium reabsorption in the kidneys, the renal tubules, so as to increase the calcium level present in the body. And then
Not just kidney. Kindly tell me about the bone and the gut.
then also in the, yes, I mentioned the gut, that it increases the calcium
Yes.
absorption in the gut, and then
Not just
in
calcium and phosphate as well.
and phosphates.
Yes, and in the bone, it
In the
causes
bone, it causes bone resorption, osteolysis,
stimulating
which makes,
osteoclast.
yes.
Okay. Can you please tell me the physiological role of parathyroid gland in the patient?
The parathyroid gland is involved in production of parathyroid hormone, which is important in the regulation of calcium homeostasis. It increases the blood level of calcium in the body.
Okay. Can you name few signs which can be important for you to confirm your diagnosis of hypocalcemia?
Chivosky sign and Trotsky sign.
Okay.
Then patient could also have circummoral numbness, and then seizure. Some of them could have seizure, and then tingling sensations.
Okay. Right. Why does the patient with hypocalcemia presents with abdominal pain? So what are the differential diagnoses that you'll consider in that scenario or in that condition?
If patient has hypoglycemia and has abdominal pain,
yes, please. What are the other differential diagnoses that you'll consider or you'll keep in your mind, considering patient is only 44 years old, not that old enough, or not that old?
Okay, I'll think of a possible.
First of all, I'll give you very easy. In exam, if it happens, patient is post-op, right? So acute pancreatitis could be one. Very, very common, very, very common.
Yes.
Then it could be renal.
Gastric or stress ulcer.
Stress, all right, very low, but renal colic could be there. Could even, if it involves intestine, so it can even lead to constipation.
I thought that should be Hypercalcemia.
No, hyper, yes.
Yes.
Hypo, yes, I asked for hypo, right, sorry.
Yes, you asked for hypo. That's why I was confused.
But in acute pancreatitis, can even be low calcium level.
Yeah. Yes, ma'am. Because of
Yeah, and
chelation of the
malignancy,
calcium.
yeah. So that one was correct, but not the renal colic.
Yes.
With renal colic, it increases. Yes, you're right.
Yeah.
Yes, sorry. So diarrhea could be there because hypocalcemia can lead to
Yeah.
diarrhea.
Diarrhea.
Yes. So that can also lead to abdominal pain.
No pains.
Yes. All right, good. Thank you.
Yes,
That
ma'am.
was the last question. Right. One last, if I ask you, how much dose would you give? How would you correct?
Yes,
Did you tell me?
Yes, to
dose?
correct, I will initially give 10% of calcium gluconate,
Yes.
10 beads slowly over 10 minutes. And then I'll now place the patient on maintenance, which is going to be about 10 to 40 millimole in 500 to 1 liter of fluid over 8 hourly.
Okay,
Then
one last quick question. How would you classify hypocalcemia? Mild, moderate, and severe.
Yeah.
What are the ranges, please? Do you know?
I'll check that up, ma. I don't
All
know.
right. So that's your homework. All right,
Yes.
good. Thank you.